What we're going to show you now is an example of how HealthInfoNet might be useful to you in terms of working with a patient that may come to see you. The example we're going to give here is a patient who came in who might have had a motor vehicle accident back in Bangor and had seen the ER physicians in that center there at Eastern Maine Medical Center. Now at this point I don't have any information about what actually happened. Yet what I can do is I can go into our HealthInfoNet directly from our EMR, so that, for instance, if I click on web lookup, I'm now in HealthInfoNet and I would simply log in here. Now you can see here that this is the production environment. For confidentiality reasons we can't go in here, but I'm going to show you what it would be like to go into this given a test environment. So I'm going to flip over to the test environment. And you can see this is the test environment. At this point I'm just going to have to log in, if I can spell correctly. And it will immediately bring me into this image and list to me the patients that I might have seen before. Now, in the production environment, it actually would identify, would link, so that if I am seeing a certain patient in our EMR, we go into HealthInfoNet, it will bring that patient up. Now, what you haven't seen in here, because I just got into this, is a front end that basically asks me why I'm going in here, and it would give me a list. And the one that I use generally is this, that I'm doing and want to access this information because of direct patient care. So I go in here, and at this point you're going to see a summary, and the summary basically has some demographic information here. It also has allergies to certain types of things that the patient may have had, shows a primary care provider and an emergency contact that might have been the attending in the emergency room. You can also see, if I go ahead and pan down, a visit history, and you can see that this patient has had a variety of visits everywhere from May until back to October. And it gives you some information about the type, what services were provided roughly, who the clinician was, and the diagnostic information here. You'll also notice over here to the left there's a whole set of information that's very useful to you. Now what I would want to do in this case that I gave you was look at an emergency visit. Now of course this is not the same patient, so therefore we have different information. But you can see that, for instance, this patient was seen maybe in, say, July 11th for an ER visit, and it loads very, very quickly, and you can see now that I can see the HPI, history of present illness, review of systems, past history, current medications the patient's on, and so on and so forth, down to the physical examination, the labs that were drawn and the lab results there that are in the progress note, all the way down to the bottom in terms of the different things that they may have done. Now understand that I normally wouldn't even receive this ER report because Bangor is distant from us and I don't have a relationship with them. Yet I can get this very, very fast. Now obviously you don't get just reports. You can also see laboratories. So if I come over here and click on lab, you can see that there's a whole bunch of lab, and I may click on this lab here, and you can see that I'm getting the information around the laboratory for that particular test or that particular day. There's microbiology information here, so that I can see, for instance, if somebody had had maybe a urine culture and I don't know the results, I can get that information quite easily. Likewise, when I go down a little bit below, if this patient who had had a motor vehicle accident maybe underwent an accident or something like that, I can see the report. Now this is a cardiology consult, but there would be a consult in here that would be reported by the orthopedic physician, orthopedic surgeon who may have done the operation. Likewise, I can see radiology. Now I can't see the actual chest x-ray itself, but what I can see is I can see the results. And of course that's something that I'm really interested in being able to see. So I think what you can see here is that there's a whole bunch of information that's available to you, and this is basically available to you in real time.